of stages to prevent the virus from infecting an individual. First, that is established as the public health measures, using face masks, hand sanitizers, etc., etc. So these are aimed at preventing the virus from entering the nasal cavity and entering the oral cavity. But they are not 100% effective. In other words, whatever we do, some of the viruses might enter our nasal cavity or oral cavity, or even through the eyes into the nasal cavity. When they get into the nasal cavity and oral cavity, they stay there for about 2 to 5 days before they attach to the mucous membrane and penetrate beyond the mucous membrane to infect cells. So there is a window of opportunity while they are in these major cavities to inactivate them with peroxide. Peroxide and influenza. Influenza is a virus that causes flu. And the hydrogen peroxide is an unstable solution, and it releases the oxygen molecule, which is known as a radical oxygen species. And this actually penetrates the membrane wall of the virus, and therefore destroys it, and the virus is unable to attach to penetrate further. And so we felt
now, Professor Ayettey, how straight away does that get to prevent the coronavirus itself?
Yeah.
How should we use it in the first place?
Oh, okay. It's been shown that even 1%, in fact, you can use 3%, but actually is adequate to inactivate the viruses. So if you do that last thing, at night or before you go to bed, that would inactivate the viruses and reduce the viral load, or even eliminate them altogether. So it protects you from being infected, and that is where our emphasis is, that you protect the individual from infection. But also when people already have the virus and they have the disease, the virus has an entry point and then it has an exit. And when it's coming out, it also prefers to use the respiratory tract. And that is why the patients eventually begin to cough and then shed the virus. So if you give the patient hydrogen peroxide mouthwash, the viruses they shed will be inactivated viruses, so they won't be able to infect their contacts, and especially health workers.
Yeah, and I know you have great experience, but majority of the people in our country may not be able to afford it, or if they can, then that is fine. Now,